Assalamualaikum and hi everyone, my name is Aras Kanai. So today I will be your MC on our topic that we're going to talk today, that is blood donation impacts on health and society. What is blood donation? So blood donation is one of safe medical procedure to draw blood from the body. So in adult human body, there's 4.4 liters to 5.5 liters of amount of blood that circulates around the body. But in some cases, when our body face malfunction, we couldn't produce insufficient amount of blood for our system to work well, and this could cause significant health effect on our body and ourselves. What makes blood transfusion is important to the people that need them, because blood does not produce outside from the body, and this could cause some serious health effect to the people that are pregnant and people that are having anemia, there is destruction of red blood cells in their body. So with blood transfusion, this effect or this health problem can be overcome by this treatment. There are a few stigma that happens around Malaysian nowadays. The first one is Malaysian people thought that when we donate blood or taken our blood outside from the body, it can cause adverse effect to them. This is totally wrong, because actually donates blood can give you more positive things than negative reaction. Secondly, although blood donation or blood transfusion does not 100% cure for every disease around the world, but it can be cure for hypovolemic shock, a condition where body is insufficient amount of blood that inside of your body. For our system to work well, our heart needs to pump enough sufficient amount of blood to supply oxygen to our body. In this case, blood transfusion treatment can be used on hypovolemic shock. There is condition where there is less amount of blood inside of the body itself. The real reason why we want to encourage Malaysian people to donate their blood, because compared to other developed countries, there's 3.3% to 5% amount of people that actually donate their blood. Compared to our country, there's only 2.2% statistically people that go out and donate their blood. That's why our resource of blood for treatment of blood transfusion is actually low compared to other developed countries. So we want to encourage people to donate their blood and create an awareness of how blood donation can save lives of people that need them.
Assalamualaikum and good morning to everyone present here today. My name is Nurul Huda Nazrin binti Nur Rasid, a biomedical scientist in Hospital Kuala Lumpur. Today I will be talking about benefits of blood donation. Blood donation was thought to be a painful and scary experience for people. But looking at the bright side of it, blood donation has much more benefits other than big scary needle poking into your arms. The first benefit of blood donation is proven to not only benefits the physical health, it also helps your emotional health by reducing stress and losing weight. There are claims that by donating blood you can burn around 650 calories. Other than that, what people normally know is by donating blood helps lower the risk of cardiovascular diseases. It's like killing two birds with one stone. And as a biomedical scientist, it is our duty to find ways to help people. Through blood donation, the discovery of new blood groups is essential as the evolution of human beings creating new blood groups that may cause complications during blood transfusion. Our duty is to find this new blood group to prevent these accidents to happen. Blood donation during this COVID season is precious and highly needed in hospitals around Malaysia, especially the blood of the former COVID patients. It is due to the patients that has been affected by this disease has the antibodies needed to fight against this virus. Thus, blood donation during these times are important as blood is always needed as COVID cases are increasing every day. Lastly, by donating blood can help indicate future health problems as we provide donors with free blood screening. Blood screening helps detect early signs of diseases such as heart attack, as Malaysia is ranked at the 64th place in cardiovascular diseases.
Assalamualaikum and hi guys, my name is Aras Kanain. I will explain to you guys about the procedure of blood donation in Pusat Darah Negara. So I, as a worker in Pusat Darah Negara, will tell you in this segment of steps that you have to take when you go to Pusat Darah Negara. The first 5 steps that you have to take when you go to Pusat Darah Negara for blood donation is, first one is registration, the second one is hemoglobin level check, the third one is screening, the fourth one is injection of blood, and the fifth one is rest, that consists of registration. It's just the general information of yourself. And the second one is about hemoglobin level. Hemoglobin level of people needs to meet up their certain range or level to get the best blood condition for the treatment to work well. So for the third one, that is screening, is to check the level of temperature, to check the level of blood pressure of the person, because to get the best condition of blood for the blood treatment to work well for the patient that needs the blood treatment. And the fourth one is for the injection of blood itself, and the fifth one is for rest and recover. After the blood inject from the body, the person is allowed to rest and recover. And there's also food that given by Pusat Negara for a person that comes and donates their blood. So all these 5 steps does not take a long time of your day. So we do encourage for every person out there, every nation, to donate their blood. That's all for my segment. Thank you.
So now let's talk about donor. Why people donate their blood? Have you ever wondered what are the benefits of blood donation? So now let me share with you guys what are the benefits in donating blood. First of all, donating blood can improve donor's lifestyle. For example, it can reduce the risk of getting cancer. Donating blood also helps in improving cardiovascular and reducing obesity. In 2007, the researchers looked at the data of over 1 million of blood donors, and among the participants, there was a 30% lower chance of dying from any cause and 4% lower chance of getting any cancer. This may indicate that donating blood is good for a person's overall health. Next is, I want to create an awareness that with just a single donation, you can save up to 3 lives. This is because the whole blood contains red cells, plasma, and also platelets. In other words, donating blood can be a life-saving action. Moving on to donors' criteria and procedures in donating blood. Before donating blood or blood products, a person should ensure that they meet the requirements. All the requirements should be guideline designed in order to protect both donor and the recipients. Here are some of the questions that were asked to me before I can donate my blood. For example, they will ask about my overall health. Do I have any existing health conditions, for example HIV or hepatitis? Do I meet pH and weight requirements? And if I have diabetes, do I manage it with medication? They also ask me if I have recently traveled or had a tattoo, and if I used any recreational drugs, especially intravenously. These are some of the examples of questions that will be asked before you can donate your blood, and also many other factors can affect the ability of a person to donate their blood. Let's proceed to procedures in blood donation. The donation and collection of blood products follow a strictly regulated process. For preparation, before donating blood, a person should try to get a good night's sleep at least 5 hours before you can donate your blood. This is because we want to avoid adverse effects such as fainting for the donors. On arriving at the donation center, they will need to register for donation. They need to complete a medical history, and they will need to undergo a physical examination. This helps to ensure that a person has not had any exposure to diseases which could affect others through a blood donation. During the donation, a person will donate 1 unit of blood which contains 300 to 450 milliliters, and this process will take approximately 6 to 10 minutes. After the donation, a healthcare provider or a nurse will apply the pressure with a cotton gauze and replace a dressing over the donor's arm. The donor will usually need to wait around 10 to 15 minutes before leaving, during which time they will receive some refreshments. This whole process will take around 45 to 60 minutes, starting from registration until successfully donating the blood. And for me, it is not a complicated process.